Good evening, everyone. I am Deepak Durgaprasad from Medworld Expo, a unified digital healthcare platform connecting manufacturers, distributors, hospitals, clinics, labs, and healthcare experts worldwide. Welcome to today's webinar. We're excited to have Dr. Raman Kumar, a dental surgeon and a public health expert, as our speaker. Dr. Kumar holds a BDS from Baba Farid University, an MPH from JNU Delhi, and is currently pursuing an MDS degree in Prosthodontics. He is also the author of the book Future in Our Hands, which focuses on connection between oral health, nutrition, and sustainable rural well-being. Today, he will be discussing on the forgotten gateway, why oral health remains the most neglected aspect of general health. We look forward to an engaging session. Over to you, sir.
Thank you, sir. Let me share my screen first. Hello, is my screen visible?
Your screen is visible, sir.
Okay. So let us start now. Good evening, everyone. And first of all, I would like to sincerely thank Medworld Expo for providing me with this wonderful platform and opportunity to present today. And it is truly an honor to be a part of this event. I would like to thank all of you, the audience, for taking out your valuable time to be here today. And your presence reflects a shared interest in learning and improving health beyond our individual field. As Sir has already As Sir has already introduced me, I will move directly to today's topic. And today I will be speaking on a subject that affects all of us, yet often goes unnoticed. That is oral health. We commonly associate oral health only with teeth, but it has a much deeper connections with our overall health and well-beings. Through this webinar, we will explore why oral health is often neglected, how it is connected to general health, and why it is deserved greater attention from all of us. This session is designed for general publics, medical students, and paramedical professionals because oral health concern us, each of us. Yes, sir. So, before we begin, let me briefly outline what we will cover in these sessions. So, in this webinar, we will first understand what oral health truly means and then explore how it affects overall health. And we will discuss why oral health is neglected and its consequences, the current scenario, and finally focus on solution, evidence, and our collective role in building a healthier future. So now it's introduction part. So oral health is often misunderstood as being limited to teeth and dental pain. In a reality, oral diseases can influence heart health, diabetes, pregnancy outcomes, nutrition, and overall well-being. Despite this neglect, oral health is common across all age groups. The encouraging fact is that most oral diseases are preventable through awareness and early care. And therefore, a common questions arise like if oral health is so important, why do we ignore it? To understand this better, we must first clarify what oral health actually includes. So, to our oral health act as a window to overall health. It acts as a mirror of systemic health. Many systemic diseases first show sign in the oral cavities, bleeding gums, ulcers, infections, and dryness. So the mouth is not separate from the body. It is a window into a overall health. Oral health includes teeth, gums, jaw joints, oral mucosa, saliva. And these structures are essential for chewing, immunity, speech, and facial aesthetics. Whatever happens in our mouth, it directly reflects in our body. Therefore, oral health directly affects confidence, nutrition, and quality of life. So, oral health is not just about brushings, it is about how we communicate, how we eat, and how we smile, and how we live. Now that we know what oral health really includes, let us see how it connected to the rest of the body. So, the oral cavity is not isolated from the body, it constantly interacts with our immune systems. Chronic oral infections, especially periodontitis, create persistent inflammations that can influence systemic health. This diagram show let me So this diagram show how periodontitis affect not just the mouth but the gut and the entire body. These harmful bacteria like P. gingivalis live deep in the periodontal pockets, which triggers the inflammatory mediators and release these mediators such as TNF alpha, interleukin 1, and interleukin 6. These bacteria and inflammatory products do not stay in the mouth. They spread through two main pathways, that is, blood streams and the swallowing. Through inflamed gums, bacteria enter circulations and lead into endotoxemia and increased gut permeabilities. And when swallowed, oral bacteria reach the gut and it disrupts normal microbiota and damage the gut lining and causing gut dysbiosis. This allows bacteria toxins to enter the bloodstream and amplifying systemic inflammations and affecting organs like the liver, pancreas, blood vessels, and adipose tissues. From this, we got a clear message that periodontitis is not just a local oral disease. It influences gut health, drives systemic inflammations, and impacting our all health. And the and what all the diseases caused through this oral with the bad oral health we can see here, which all the diseases linked with this periodontitis are like heart diseases, lupus erythematosus, pregnancy complications, cancer, anemic patients, diabetes, rheumatic arthritis. And from this we can see that our oral health is directly linked with our immune systems, and we understand that disconnections from the previous slides. And when we see that this connection is ignored at the population level, it results in a silent and yet massive health burdens. And we see the global statistics about this oral health issues. So there are 3.5 billion people suffer oral diseases globally. Dental caries is most common diseases known to mankind, and periodontitis is strongly associated with systemic illness. Oral diseases rarely cause immediate death. Instead, they progress silently and often unnoticed. By the time pain appears, significant damage has already occurred. The silent progression led to the tooth loss and difficulty in eating and poor nutrition and affect overall health and quality of life, and especially in the adult and the elderly. The irony is that the most oral diseases are preventable, and yet they remain among the most common diseases globally. So, if this problem is so widespread, let us look at the current scenario of India to see where we stand today. So, according to according to the National Oral Health Survey conducted by the Ministry of Health and Family Welfare in 2017, they found that there is a 14% of the adult who lost their tooth, and there is a 60% of children suffering from the tooth decay, and 57.5% of Indians suffering from gum diseases, and the oral cancer constitute 30% of the all cancers. And now that in 2022 there is a report, the global report, there is a status of the oral cancer. We see that oral cancer is one the rank one in among the five most major cancers, and nearly five people die every hour in India with this oral cancer. And recently in 2025, there is a summit happened at the Oral Health Movement Summit in 2025 in New Delhi, in which the MD and CEO of the Colgate Palmolive, they highlighted that 90% of the Indian suffer dental issues, but only 9% visit dentist. So where they visit, we can see in the upcoming slide. They visit to the quacks. When the awareness is low and access is limited, quackery fill the vacuums that unqualified practitioners and promise quick and cheap solutions, but deliver long-term damage, and this result in delayed diagnosis, irreversible harm, fear, and mistrust towards dentistry. Quackery is not just a dental issues; it is a systemic public health failure. And this naturally raises an important questions. Why is oral health still get neglected? So there is no single answer for this. Oral health neglect is a multifactorial, and to understand this clearly, let us examine the key factor one by one. And these are the key factors like patient related, social and cultural related, healthcare delivery related, and policy and public health priorities related. So first is the patient-related factor. It play a major role. Like many individuals are still not fully aware that oral health is directly linked to overall health, nutrition, and quality of life. And for most of the people, dental visit happen only when there is a pain and swellings or a visual problems and not for preventions. And there is a fear and anxiety also associated with dental procedure, which further discourage timely care. And at last, there is a cost perceptions that dental treatment is often perceived as expensive and non-essentials, so people tend to postpone it until the problem becomes severe. Now, second, there is a social and cultural factors which also contribute significantly in the oral health neglect. Like in many families, oral health is not given as the same priority as the other health concerns. And household with unhealthy dietary habits are more prone to oral infections and dental diseases. Tooth loss is often wrongly accepted as normal part of the aging, where in reality, tooth loss in adult is not normal and usually indicate underlying oral health problem. Many people also rely on home remedies before seeking professional dental care. Oral hygiene practices are largely influenced by family environment and where habits are inherited across generations. Good practice tend to be passed on and sustained, while neglect of oral hygiene in one generation often result in similar patterns of poor oral health in the next. So there's a third healthcare related factors. They also play an important role in the oral health neglect. Like if we talk about structural separations, the dentistry often function in isolation from the general medical cares, with limited integration between oral health and overall health services. If we see there is a limited routines screening, like uh, when there is a general screening, they miss the oral screening, and there's excess variability. Like there's a urban and rural gaps between the accessibility of the oral health care, and due to this is also one of the factor which affect the which neglect the oral health. And the last is the creative orientations. Like the most of the healthcare system is largely treatment oriented and focusing more on managing diseases rather than promoting preventive oral health practice and long term wellness. So finally, there is the last policy and public health environment factor, which play a critical role. Like oral health, often compete with multiple high burden health priorities such as infection diseases, maternal and child health, and non-communicable diseases like BP, like hypertension, we can say, which reduce its attention in public health agendas. Like this is also another reasons source allocation challenges like funding and sources for preventive dentistry and community outreach programs and oral health education remain inadequate. And oral health is gradually being integrated into national and public health programs, but implementation is uneven and slow. And there is a need for collaborations like policy level coordination between dental service and general healthcare is still developing, resulting in a fragmented care, limited surveillance data, and missed opportunity to address oral health as an essential component of overall health and well-being. There are other contributing factors for oral health neglect. These are like physical and functional barriers. In this, like for individuals with disabilities, mobility limitations, or chronic illness, simply reaching a dental clinic or tolerating chair positionings can be difficult, and as a result, what happens? Dental care is often postponed. And these older adults with functional declines are particularly vulnerable and are more likely to skip dental visit, leading to unmet oral health needs. And there's a comorbid medical conditions also in people with comorbid medical conditions such as diabetes or immunocompromised states. Dental treatment becomes more complex, and medical priority often take precedence over oral care. And there is the emotional and behavioral aspect also, which neglect the oral health, like there is a low self-efficacy or fatalistic attitudes, such as believing that it is too late to improve oral health, which reduce motivations for preventive cares. For many individuals, like immediate life priorities like food, shelter, or work naturally take precedence, and oral care is viewed as a non-urgent until pain occur. And there are cultural belief also, like cultural beliefs and relies on traditional remedies also and play a role, and where tooth loss may be considered as normal part of the aging and reducing the perceived need for the professional dental care. And the last, there is a life course and demographic drivers. Children, there are certain groups, including children from vulnerable household, adults and pregnant women, and the older adults experience higher unmet oral health needs. How? This is not due to a single factors, but a combination of financial constraint, social circumstances, behavioral challenges that changes across different stage of life. Now, when these barriers remain unaddressed, the consequences extended beyond the mouth and significantly impact overall health and quality of life. When we ignore oral health, the consequences slowly spread across life. It led to systemic diseases, chronic pain, persistent infections, nutritional problem, speech difficulty, and it affects self-esteem and led to a social withdrawals. And the worst part is that people land up in the clinic only when the diseases become severe and painful and expensive. And the encouraging news is that this cycle of the neglect can be broken. How? We will read in next slide. So there's a solution that how to break the cycles. To break this cycle, we must make oral health as a priority, and a multi-level approach is essentials. First, dental care must be integrated into primary health care so oral health become a routine part of general health services. Fear associated with dental treatment can be reduced through patient-friendly and pain-friendly approaches that build trust and comfort. And also, making oral health screening mandatory in medical OPD will help in early identifications of problems before they become severe. And at the community level, affordable and accessible dental services are needed, especially in underserved areas. And school based preventive programs can instill good oral hygiene habits early in the life, while teledentistry can bridge the gap in rural and remote regions by providing consultations and follow ups. Equally important are awareness and behavior change programs that educate people and empower communities with oral health literacy. Strong interdisciplinary collaborations between dental professionals, medical doctors, and nursing staffs will ensure holistic patient care. And finally, implement, rigorous and well implemented oral health policies are crucial to sustain these efforts and bring oral health into the mainstream public health agendas. All these solutions are not just opinions, they are supported by a scientific evidence. And the evidence comes in the next slides. Evidence from the Lancet, WHO, ADA, FDI clearly established that oral health is inseparable from general health. Oral diseases are now recognized as a major non-communicable diseases requiring preventive strategies. There is a recent that WHO Bangkok declarations mark a historic shift by recognizing oral health as essential to overall health. It emphasizes prevention, first care, and commit to universal oral health coverage by 2030. Why this declarations matter for us? Because this is the first global oral health commitment since 2007, and which and the silence that dental health is not optional and it should be inclusive with the general health. And and they include that they shift from the pain driven treatment toward the preventions, and they set the agenda for the UN high level meeting also in 2025, which held in 2025 at the month of September. So to change this, we have to play different roles by the different individuals. So these things happen only when the professional educates, institutional collaborates, and individual adopt preventive habits. Improving oral health is a shared responsibility, and if we act collectively, we can create a healthier futures. And for general public, what they have to play a role, they have to practice a daily oral hygienes. They schedule regular dental checkup, and they should not ignore early signs like bleeding gums or bad breaths, and they should teach their kids by the example. For professionals, they recognize oral health as a part of systemic health, and they include basic oral screening in their routine examinations, and they should refer patients early for dental evaluations. For policymakers, they should include oral health in the primary health care, and they should support dental units and teledentistries. And they should allocate funds for schools and rural oral health programs. For medical students, they should advocate for integration. They should understand the link between the systemic health and the oral health. For paramedical students and healthcare workers, they should educate patients and communities about oral hygienes. They should encourage preventive dental visits and support early identifications and referrals. Like we have know that prevention is cheaper than cure. For NGOs, they should organize community outreach programs for the preventive purpose, for the, for the preventive purpose only. Yes. So, vision for the futures. A nation that smiles. So, what I imagine as a future where oral health is not seen as separate from the general health, a future where oral health is a part of routine health care and prevention is prioritized and awareness is universal. And medical, dental, and paramedical profession work together. That is the visions of a nation that truly smiles. With these visions in mind, I would like to conclude that the mouth is the mirror of the body, and if we neglect our oral health, we are actually neglecting our overall health. Prevention is simple, affordable, and powerful. Let us treat oral health as a gateway and not as a afterthought. These are the few references which I have used to make my this webinar, and few I have not added in this PPT slides. If you guys want, then you can contact me in the given email IDs. And thank you for your time and attentions. And I now welcome your questions and thought. Thank you, sir.
Yeah, thank you for the wonderful session, sir.
Thank you, sir.
Yeah, there is a question from Ali. What are the long-term consequences of neglecting oral hygiene?
Okay, yes. And so, or actually, which we have this now in the slides that oral health, when we are neglecting oral health, what we are doing, we are neglecting our overall general health. And how we will know about this? That our oral health, like any oral disease, is a slowly growing diseases, and it is like individual. But when we go in our adult age, when we in the later stage, the diseases which are linked with the oral health, they start coming up here, like the diabetes or hypertension, such kind of things appears in our later life after like in the adult life after 30s to 40s age.
And there is one more question, sir. How does
Yes.
poor oral health affect overall physical health?
Yes, like I will tell you with the example, like if someone have no tooth in their mouth, like he is a professional, he is doing job, he is a teacher, we can say he's a teacher, and he have like missing anterior tooth, how he will present in their like in front of the in front of their students. These are the cases, and like they are asking about the physical health, like ultimately when there is a our oral health is not good, ultimately it affect our general health, and our oral health is linked with our immune systems, and our immune system fight for our oral health, and like it will ultimately affect our physical health also. We will be like we will not be healthy, and we will be like sick all the time when we face that overall, when we face the systemic illness. About like we can say, if patient is suffering from diabetes, if patient suffering from diabetes, then what happen, the symptoms show in our oral health, and the gums bleeding regularly. If there's a little pinpoint puncture happens in their skin, it will not heal so soon. So all these things are linked with our physical health as well as our general health.
And there's one more question, sir. Why is oral
Yes.
health often separated from general healthcare in public perception?
Yes. The reason behind this is not a single reason. It is like collectively responsible. Like we, peoples are also responsible, and as well as our systems are also responsible. And there's a they both are responsible, and there are other factors also which I have already discussed. Like what happened, we are not promoting preventions, and we are not spreading awareness campaign throughout the peoples, and which leads these conditions. So that's why the people neglect our oral health. And this is also one reason that like people mostly this is like painless, and this is not life threatening problem. Oral health is not a life threatening, and people try to avoid it because they think that when there is a severe pain, then only they will visit to dentist, and if there is a minute caries, they will not go. So there's not, they feel that there's no effect, but what happens in our body, there's a consequences happen later on. Yes, sir.
And we have one last question, sir, from Bhuwana. Why do many people visit a dentist only when there is a pain?
This is a perceptions made by the people that like few people visit to the quacks. Nowadays we see there the quacks are more in the society, and people don't visit to the dentist, and they visit during the pain only. The reason is only that it is it is a painless diseases. Okay, like cavities early in earlier stage, like we have enamel layer, we have dental dentine, then we have pulp. When the diseases reach to the pulp, and we start feeling sensitivity, and when we start feeling sensitivity, then only people feel that there is a something in our mouth which is creating problem, then they will visit to the dentist. Rest they don't visit, like in if there is a minute caries, or they don't visit, or there's a calculus accumulation, they don't visit. They feel it is not hurt, they are not hurting them, so they don't visit. But when it start hurting, then only they feel that it's then only they feel that we should go to a dentist. But when they visit to a dentist, it is too late to visit to a dentist. Like there's a lot other issues also happening in our mouth.
Thank you so much, sir. That's all from the chat box. Like before we close, I just wanted to take 2 minutes of time and explain how Medworld Expo will help all the medical professionals like you, like doctors and all the medical students and all the healthcare organizations as well. So
Yes.
I'll just take 2 minutes, not more than that. And before closing, we can talk. Like, thank you, sir. I hope my screen is visible. Okay. Thank you so much, sir. So whenever you open Medworld Expo, like everybody we can see the platform like this is a landing page. So if I come little down, you will be able to see our success stories. At present, we have more than 7,000 plus manufacturers, 12,000 plus medical distributors, and more than 2 lakh products is already listed over in our platform. With that, the major thing I just wanted to showcase here is we have 1400 like 14,700 plus healthcare service providers like doctors like Ramana sir, like medical students and healthcare organizations. So there are so many healthcare professionals in the platform. So I just wanted to highlight the thing how it can be helpful to the medical professionals. So if you can see events option over here, you can able to attend different kind of webinars through our platform, which is completely free of cost. And we have CME programs, which is upcoming, which is credit based programs. And next we have knowledge here. As you are a healthcare professional, you are the major one who need to be up to date with news and insights of latest healthcare, right? So our platform is the right choice for you to be stay updated with all the knowledge which is related to healthcare. And we have Medwell blogs. So if you can see, there are so many doctors, so many organizations, so many students, different healthcare professionals are writing different types of blogs over here. This will help you if you have any questions related to the particular topic, or if you wanted to write any kind of blog, maybe you can also write blog, sir. I wish, Ramana sir, if you're free anytime, just you can take 10 minutes of your time and you can write a blog over here.
Sure, sure, sir.
Thank you, sir. Thank you so much. And the other major highlight thing is the medical communities. As you are into healthcare, you must be having good networking as you in your lifetime, right? So that is the reason we came up with Medworld communities, where you can create your own community with whatever the specialty that you're looking for, or else if you're looking to join any kind of other specialty people, and you can directly join to the particular community, and you can chat with them, talk to them, and you can clear your queries whatever you're having, and you can post your questions as well whatever you have in the medical communities. So this kind of option that we are giving to network with n number of people in the healthcare sector across the globe. So that is a major thing I just wanted to highlight more. And we have healthcare journals and magazines. So in healthcare and medical, most of the people always look to write articles, research papers, journals. So I can help, like our platform can help you out to find out the right journals for you to make your citations or make your whatever the work that you're looking for. You will be getting a good type of documents and magazines through our platform. Maybe you can use it for your citations as well. And we have career advancement program. If any healthcare professional is looking to pursue higher studies in any country, so we will guide them, we will show the roadmap for the next 2 years or 3 years, what kind of career they have to choose, what kind of specialty they have to take, which country they need to choose, what would be the free structure and everything. So we can help you out, any medical professional who is looking to pursue their higher studies in abroad. And last but not least, I just wanted to highlight the other thing is jobs. So in market, we have so many job platforms which is not properly categorized. So if you can see Medworld Expo job platform, it is completely specialized for medical sector itself and healthcare. So if you are looking for a job, or if you are an employer, you can post a job and you can hire a candidate. And if you're looking for a job, you can directly apply for any kind of healthcare organization, and you can directly find a very good opportunities through our platform. We have n number of organizations which is actively hiring. Maybe if you have a plan of changing a job, or if you're looking for a job, maybe a Medworld Expo is the right platform for you to choose, just because our platform is completely dedicated to the healthcare sector. So your profile will go to the right place, right person, and you will be completely selected easily. I can just say that thing. And that's all about Medworld Expo. If you haven't signed up to Medworld Expo, please do visit www.medworldexpo.com. And it is very easy to sign up directly. If you will be able to see an option, you can directly create an account from here. If you can see register, you can click on healthcare service provider, and you can select individual or organization, and you can select your role, and you can create your email. You can select your email address and password, and you can create your account. So if you have any queries, there will be an option, number or email. You can write or drop any message through email and phone. We will be always available for you. And I'm really thank you so much for all of you for being patient from last 40 minutes. And thank you so much, Ramana sir, for being here today and giving us the valuable session. So before we close, would you like to give any kind of closing statement?
No, thank you so much for listening me, and I'm thankful to you also, and for this Med World Expo to giving us a chance and giving everyone a chance to speak and show their knowledge and show their interest, and building a healthier environment for upcoming like young healthcare professionals.
Thank you, sir.
Thank
Thank
you.
you so much. We look forward for more session from you. Like we might, we can do another collaboration as well. Like whenever you're free. Thank you so much for your time today, and thank you so much, audience, for being patient from last 40 minutes. Thank you so much. Have a very good day. Have a good weekend as well.
Thank you, sir.
Thank you, sir.